This was something that continues to really pinch people's budgets, and it pinches the state of Florida's budget, because in our programs, when we do with health programs, it causes the cost of those to go up dramatically. And so we were trying to figure out ways, okay, what can we do to make an impact? Of course, now you see, particularly over the last year and a half, you've seen big increases in groceries, you've seen big increases in energy, utilities, rent, all these different things with the Biden inflation. And so I think the drugs and being able to give some relief there, now more than ever is something that's very, very important. But back in 2019, my first year in office, we wanted to find ways. So we're limited as the state because a lot of this is controlled by the federal government. Obviously, Big Pharma is very powerful in Congress and with different people in Washington, and so they're able to structure this a lot of times in ways that benefit them over the average American. But we want to say, is there something a state could do? Well, we found there was a provision of a law from 2003 that said states could apply to HHS to purchase drugs from Canada. And so these are the same drugs that you purchase here. They're just like 80% cheaper or 75% cheaper. And it's all because, basically American consumers underwrite the entire pharmaceutical industry. They get cheaper prices everywhere else outside the United States, and then we basically fund all the research and development and everything that goes into producing these. And so it's definitely inequitable. And so we said, if we can use this program and be able to contract, even if we just started with state agencies contracting, we'd be able to save, $100 million, $200 million for taxpayers. And then obviously, that will trickle down to consumers, and we would be able to expand this. So I went up to Washington. I met with President Trump. I told them this is something that's really good. And a lot of people were telling him no because you had pharma doesn't like it. I actually was, had a discussion in the Oval Office with the president and people at HHS and these other agencies, and they were saying no, no, no. And basically they tried to say it's a safety issue. But people use drugs in Canada. This isn't Djibouti. I mean, it's a safe country, and so you can get drugs and do so. But if it does involve relabeling and make sure that everything is accurate and they're bona fide pharmaceuticals and not counterfeit. So there is things to do, but that's something that's easily attainable. And so President Trump said, yes, I will approve. And so we developed, so the legislature passed this law saying Florida needs to develop a plan. We created this plan, and it took a long time to be able to get that just right. We sent it up to Washington during the Trump administration for approval from the FDA. So this was in the latter part of 2020, almost 2 years ago that they've had this. And we didn't know, like when Biden came in, whether this would be something that he would support or not. He actually said last summer, he signed an executive order saying he wants to approve these plans for states. And so that was, I think he did that in like June or July of 2021. And so here we are now. Our application has been, we were the first state to do this. Other states followed Florida's model. It's just been sitting at FDA for months and months and months, actually probably over a year and a half, and no action. And so Biden is saying he wants this for consumers, but yet his administration is not willing to act to be able to approve it so that people have access to more affordable pharmaceuticals. And so, our view is okay. When he said last summer that he supported it, we were hoping that we would get an answer. I think it's even hard. I mean, some of these folks will tell you, it's hard to even meet with people at the FDA. Very dismissive, very arrogant with how they've gone about this stuff. But our view is we need to keep pressing forward. So after 630 days, we still sit here waiting for an answer. And so it's our view that we've waited long enough. And so today we're taking action. The state of Florida has now filed a lawsuit against the FDA. They have unlawfully withheld and unreasonably delayed approval of Florida's program, and we think this violates federal law. So we're asking a federal judge to order the FDA to put an end to that delay and to approve Florida's program. Included in the lawsuit are claims under the Federal Freedom of Information Act. In early July, ACA filed a FOIA request seeking records from the FDA to increase transparency on their approval process. Under the Act, FDA had 30 working days to respond to our request, and I don't think you'll be too surprised, we still have not received a response to our request. So the clock's been ticking. We have a right to know what the FDA has been doing the last 2 years to ensure that are they putting politics over patients? Are they putting the interest of big pharma over the interest of average Floridians and taxpayers? And that's what we need to find out. So we've been continuing to push for transparency. Why are we here? Because this is a distribution facility. All this stuff is ready to go at this point. It's turnkey. We have people that are dealing with the Canadian companies. We will have them, they can be brought here. They get labeled properly, inspected, and then they can then be used in the general public. Obviously, Florida is going to buy a lot of these for our programs. It's going to save us a huge amount of money. So all this stuff is locked and loaded, ready to go, and it has been ready to go for quite some time. So we've been waiting and waiting and waiting. We've done everything that we need to do to get this moving, and I think it's really, really important. I mean, especially